nation's business. We take a look at how authorities are trying to contain the dengue fever outbreak in the country. We also discuss the socio-economic impacts of dengue, not just nationally, but regionally and also on the global scale. The most deadly animal in the world is the mosquito. It might seem impossible that something so minuscule can kill so many people, but it's true. According to the World Health Organization, mosquito bites result in the deaths of more than 1 million people every year. It is estimated to have been responsible for as many as 46 billion deaths over the history of humanity. That staggering number is even more frightening in context. It means that mosquitoes are alleged to have killed more than half the humans that ever lived. The incidence of dengue has dramatically increased around the world in recent decades. The World Health Organization estimates that a staggering 2.5 billion people are now at risk from dengue. That's over 40% of the world population.
Dengue is absolutely not confined to Fiji. The dengue is all over the continents of the world, especially in the South Americas, in the Asian region, basically in Africa, Central and South Africa. So it's all over the globe. High-risk spots are basically identified everywhere by the World Health Organization. We've got about 2 billion people at risk of dengue fever, 50,000 or so deaths in a year, 500,000, a million or so cases in a year. So you know, these statistics speak for itself.
The Pacific region has never before been more susceptible to this mosquito-borne viral disease than now.
There is what we call a Pacific-wide dengue epidemic or outbreak because of this dengue 3 serotype or strain that hasn't circulated in the Pacific for a long time. So this is not just a phenomenon in Fiji, this is a phenomenon in a number of other countries, including Kiribati. Last year the Solomon Islands was the same type 3 dengue. French Polynesia, there have been cases reported from New Caledonia. Vanuatu has quite a large number of cases. And on top of that, there are a couple of other countries that have reported dengue cases, but they haven't been confirmed. But we're concerned that this serotype will continue to move through the Pacific.
It's been circulating in the Pacific since 2013. It just knocked on our doors. The same strain of dengue, to say. It knocked on our doors in December last year, so we were kind of the last ones of the year to get this this outbreak going from last year. So yeah, it's all over the world.
The dengue outbreak in Fiji was recognized in early December last year. And from then up until March 21st this year, an alarming 15,446 suspected cases have been reported to the Ministry of Health. That's an average of 140 reported cases per day. And it's a different type of dengue, one that has not been in Fiji for quite some time.
There's the element of having a different strain of virus that comes into the country. Fiji is endemic to dengue fever, but it's endemic to the dengue fever virus serotype 1, as it is at the moment. So it's not really, you know, endemic or immune to the dengue 3 that we have. Dengue 3, but all 4 strains have passed through Fiji. This one has passed maybe 15 to 20 years ago. So people right now are not necessarily immune to this disease, to this serotype of the dengue, so that when it comes in, it tends to put them at risk of getting severe disease and also of, you know, an exponential rise in cases, which we have right now. It is a dengue outbreak.
So far, 12 people have lost their lives as a result of this mosquito-borne viral disease. 6 from the Central and 4 from the Western Division. The Eastern and the Northern Division each recording 1 death each. The youngest victim, a 2.5-month-old baby.
The epicenter is largely around urbanized centers within Fiji, but the epicenter, as you say, is in the capital, Suva, in the Central Division. So there's a couple of theories to that, or hypotheses, and that is, you know, it depends on the density of mosquito. Also, the amount of rubbish that we actually churn out, especially these receptacles that mosquitoes prefer to breed in. These are containers, and drums and tires, and we find all these items, especially in the urbanized areas. So that if you don't discard it the way that it should, then it's around there for mosquitoes to breed in, especially if there's water, clear still waters. That's where the mosquitoes tend to ovipost, as they call it, meaning breed. You see it also in Lautoka and you see it in Lambasa. So there's questions to the public health infrastructure in terms of environmental health. Are we taking out all the rubbish that we're supposed to? Municipalities, a couple of people here that need to probably step up together with the communities. They're supposed to dispose of the rubbish, and then the municipalities from there dispose it out to wherever the waste areas have been allocated. So it's a combination of things, a combination of the density of mosquitoes, a combination of the climate. There are certain climates that the mosquito tends to breed in. It's a combination of the density of people who are at risk, the population who are at risk of actually getting these dengue diseases, and also the health infrastructure, the infrastructure for discarding all these items.
With an aggressive campaign carried out over recent months, Fijians are now realizing that this is a serious outbreak, and many are taking the necessary preventative measures.
So I don't want to cut mosquito on my children. I want to clean my boundary nicely. That's the way mosquito can run away.
At the moment, I'm keeping my area clean. Because if your area is clean and neat and tidy, everything, if you keep yourself neat and tidy, good looking, your area should be like that. If the thing is clean, that you can stop dengue. I think we should tell our neighbors to promote them to tell your families, even your friends, to take some actions on your community or your community leader to just visit you around your compound.
Authorities say the outbreak is now fast becoming a social issue, with communities urged to take a more proactive role in the fight against dengue.
When diseases like this get out of control, we tend to look at it as a social issue, no longer a health issue. So that is where it's going right now, with regards to cleanup campaigns, mobilizing people in order for them to, join into the fight of dengue, arresting dengue. And that is where it's going. That is where it's going, where we get the communities to mobilize. It's become a social event now.
Fiji is one of the 125 countries known to be dengue endemic. And with the number of suspected cases in the country steadily escalating, stakeholders say a more concerted effort is needed to win the fight against dengue.
The fight is against the mosquito. So dengue will be transmitted from one person to another through the mosquito. It's a specific mosquito that lives in and around the house. So this is the fight against them, and it's important for the public to understand this. And it's also important for each individual to understand that if you don't go out to clean up, if you don't take that responsibility, perhaps someone within your family might get very sick and perhaps might die just because of that. You haven't contributed enough to cleaning up in order to destroy these mosquitoes.
Those who have recovered from this viral disease know all too well just how deadly it can be.
It started with body pains and then splitting headaches. I had very high fever, and whenever I used to take paracetamol, I used to sweat a lot, and then it stopped and then started again. And all my joints were paining. I couldn't get up. I didn't eat anything. I didn't feel like eating anything.
I had body pains too, and then went worse with my head. And I started this very, very bad headache, like my head was about to burst, just on one side, and then it started bleeding in my gums. And I started taking Panadols, Powerades, but it's still there. Trying to get over it.
Please don't get it.
I don't
It's
think
very
so.
bad.
Some people would survive the pain I went through.
Yeah, it's very
The
painful.
pain I went through, I think only I know. It was like crawling from this corner to that corner. So I couldn't stand the pain. That's how bad that pain is. Dengue is better to be safe.
Over the past few months, supermarkets have recorded a marked increase in the sales of mosquito coils and repellents. This is a positive sign that people are taking precautionary measures to keep themselves safe from the dengue mosquito.
Like we can see that plenty customers are buying this mosquito coil, and they are buying in lots. Like before, the sale was very low, but compared to this dengue fever and all this awareness, the customers are buying plenty packets of mosquito coil. Like some of my staffs have been through this, and some of the customers, we are talking with our customers, they are just went through this, and it's very dangerous.
Yeah, plenty people coming in and out and going with mosquitoes, mosquito coils and everything, and they're just preventing themselves from dengue. Yeah? So last week also we had big sales of mosquito coils, and this is the second week going. Like it's not a second week, like dengue has been spread for a month, 2 months ago. Yeah? So people are buying a lot.
While these businesses may somewhat be benefiting economically from the dengue outbreak, the same cannot be said for the health sector, with more strain being felt by hospitals and health facilities in major divisions.
With the surge in dengue fever cases, we've been, in the hospital, we've been trying to absorb the masses that come in. On one hand, it's a good thing that people are presenting early. On the other hand, it really puts a strain on the hospital resources. We have been obliged to bring more beds in some of the subdivisional hospitals. They have had to create new infrastructure, maybe temporary ones, shelters for their general outpatients, just to manage the mess. They've put in a triage system where all dengue-like illnesses just move to one side of the clinic and a doctor there looks after them. So we've been trying to manage all this all together, and it's quite a burden. And the only solution to this without a vaccine, is for us to destroy breeding grounds. So it comes back to those who are not sick. For those who are not sick, get out there and just clean up. Clean up and destroy those breeding grounds so that we can reduce the burden on our own families and also reduce the burden on our health system.
It's clear that it's having a major impact on the resources, specifically in the health sector. So I think anyone who is working in the health facilities will tell you, particularly here in Suva and in the Central Division, the burden, the large number of cases they're seeing, both ambulatory in the outpatient setting and in the inpatient setting. So what we call the surge capacity, or the capacity of the health facilities to absorb this large number of cases, is really, I think, close to the maximum. But considering the very large number of cases, I think they've responded very well. In the west and in the north of Fiji, the numbers have been lower thus far, but it does appear as though the epicenter or the main burden of the outbreak is starting to shift to the west, and I think after that the north.
The livelihoods of the families of dengue patients have also been affected.
The burden of dengue is very widespread. It's not only in health, where you look at morbidity, sickness, and also deaths. It spans the whole range into social, into behavioral, into economics. Definitely economics. It becomes a huge burden on economics. And basically, not only economics in terms of the ministry, but in economics too in terms of the people who are affected. This disease tends to affect the marginally poor people. So we can imagine, people who are already struggling at that level of poverty get sick, especially the breadwinners. It becomes a really big issue. And that's why, together with the community, this for us is a very big issue because of those people. We want to, not only them, but also others who can get really severely affected by the disease and probably die. So it's not really one person in particular, but the whole community in general. We're taking all those aspects, social, economic, and all these aspects into perspective here.
While the dengue outbreak may be straining resources within the health sector, The Health Ministry says they are financially secure to continue the fight against dengue fever.
The ministry has contingency allocations that it tends to draw from, and also, also the government at large. So this is an emergency situation. An outbreak situation is always an emergency situation for the government. So it has some funds that it will allocate for this, and that is the funds that we're working on specific areas of our strategic plan for dengue. Or action plan for dengue, but there's also funds that come in from donors that the ministry is quite appreciative of, and we're using these funds according to the plans that we have. So we actually have a plan, and it's been it's been budgeted, and funds are coming in order to facilitate those the plan itself. So we've got funds, and with regards to the intervention for the nation at large, that is basically a crucial aspect that we have, funding, and yes, we have funds for it.
A lot needs to be done. A lot needs to be done in the awareness, a lot needs to be done in the cleanup.
The Commissioner Western, Commander Choeli Dawaki, has taken the lead role in the cleanup campaign in the Western Division, and he has urged residents in the West to actively support this national dengue outbreak control strategy.
We welcome the support of the private sectors. We welcome the support of the organizations that are here in the Western Division. It is, as I said from the beginning, this is not only a government program. It is now a Western Division, the whole of the Western Division approach that we will be using. I must also acknowledge some of the supports coming from the private sectors in supporting the cleanup, and also supporting the initiatives that the task force has been doing.
The Health Ministry is now being supported technically by the World Health Organization, UNICEF, and the Fiji Health Sector Support Program to help address the dengue outbreak. The Australian government, through its Australian Aid Program, has pledged its assistance in the form of $1.2 million. This is expected to help fund our Health Ministry's plan of action over the next 3 months.
So we have that 3-month plan. The plan is in 4 thematic areas, and the thematic areas of responses, or thematic areas of response. So the thematic areas are surveillance, there's clinical management, there's prevention and control, and also there's communication. So those areas are funded, so there's detailed activity plans in those. And it's not only for the epicenter, but for Fiji as a whole.
Dengue is the most threatening and fastest spreading mosquito-borne disease, and is definitely a bigger threat now than ever before. And stakeholders continue to urge members of the public to keep an eye out for the symptoms of dengue. The prompt detection of dengue cases and appropriate clinical management does save lives.
When you have the classical symptoms of fever, that you do some home remedies within the first 24 to 36 hours. Take Panadol or paracetamol, and also hydrate. Lots of hydration. Get some rest. Drink some fluids. Have some soup. Rest. After that, if your symptoms don't go away or get severe, it's important for you to visit the hospital. Now, if you get to the hospital and you see a doctor, and the doctor tells you to come back for a review, this is a very important advice, that you come back for that review. The other advice the doctor would give you is, if you're at home waiting for the review and you get very sick, and you get severe symptoms of dengue, which is bleeding of the gums, the rashes that come on, severe vomiting, abdominal pain, you have to come back quickly to the hospital. You can't wait for the review date, primarily because you can get really sick, and perhaps it can be fatal when waiting. So this is what we see with all these cases that have actually died.
With 15,446 suspected cases and 12 deaths recorded as of March 21st, authorities continue to reiterate their calls for sustainable preventative measures.
It could have been worse, it could have been worse like in other Asian countries in the Western Pacific region, but this is what the situation we have. We've been trying very hard to intensify all our interventional activities against dengue. It's probably working. In the past week it's come down a little bit to 880 in the last week. We're hoping that the trend will continue. And it's favorable in our case, and then we seize the outbreak in a few weeks' time, but that is still to be seen. Every time the onus is on the public, the health ministry is just there as custodians of health, just to intervene clinically and in terms of public health. But at the end of the day, the onus remains with the community. Theirs is the ownership of all this.
And before we leave you, here's a message from the Ministry of Health.
Mosquitoes are bred at home and can make us sick. I know because I've had dengue. But in 10 minutes, you too can destroy mosquito breeding places around your home. Let me show you how. Empty water from pot plants. Empty water from cans and containers. Ensure your guttering is free from leaves and water. Look for rubbish that can hold water and dispose of it properly. Change the water in your flower vases regularly. But also remember to keep your family safe by using mosquito nets and mosquito coils safely. Apply mosquito repellent when going outdoors and use other mosquito repellent devices around your home. By following these simple steps, you too can prevent dengue.